name is Jenna Greco. I'm a registered nurse, and I'm a board certified critical care registered nurse as well.
And why did you choose nursing?
So I chose nursing because when I was younger, I was admitted to the hospital quite a few times. I had a few surgeries, and the impact that the doctors and just the nurses all around had on me at such a young age, at the age of 7 years old, really played an impact on me going forward in life. My mom's also a nurse. I have many family members in the medical field as well, and they were all such an inspiration, and I really just took off from there, and my interest in medicine and everything along those lines really brought me to the point as to where I am today.
Oh, that is awesome. And I understand that you're one of those rare nurses that during this time of a pandemic that you chose to go running into the fire of caring for patients through this pandemic rather than staying home. And it's like, no, not me. What
Mm-hmm.
made you decide to do that? I mean, it takes a lot of bravery and selflessness.
Right. So being that I was already working in the ICU, all of the patients that had COVID were admitted into the ICUs when this all kind of first started. So basically there was no real choice to not be able to work. However, I think that this experience made me such a confident and better nurse all around because it really was able to exemplify the skills that I didn't know I had until I was put to the test. And from there, I took off with it and I decided to do travel nursing and go into another hotspot down here in Atlanta, Georgia to take on another pandemic down here and jump right back into the fire because I knew with what I did up in New York, I can basically take that experience and the knowledge I gained throughout that and bring it with me wherever I went.
Oh, that's excellent. Share with us a little bit about the skills that you feel that you were able to kind of like fine tune that you already had, but caring for, I would assume from talking to other nurses, you know, taking care of COVID patients that triples and quadruples in an ICU became rather common. And that takes a whole set of organizational skills that I think are just, to me, they're overwhelming. And I'm an old ICU nurse. I don't know how you do it. So share a little bit about what that was like and how you kind of had to adapt.
Absolutely. So typically in the ICU, it's always a 1 to 2 patient ratio. So being that we had such a high influx of these COVID patients coming in, you know, we were doubled and tripled and quadrupled in numbers of patients that we had to take. So at some points I was taking up to 4 patients. So I kind of had to do what I would do on a normal day with 2 patients with now 4 patients that are, you know, just as sick as the 1 or 2 patients would be. So I really had to learn a lot of time management, a lot of, you know, way more intense critical thinking skills, definitely being on top of my feet and on top of things 24/7, watching these vital signs to anticipate any changes that could happen because things happen very quick. They're usually fine 1 minute and then a few minutes go by or an hour goes by and something can happen so rapidly where their state, they just completely deteriorate in front of your eyes, and you have to try to stabilize them the best you can in that short time period, along with keeping an eye on the other 3 patients that you have when they're just as sick.
But Jenna, how do you physically do that? Because you have to completely change your PPE, and it's not like there's 2 patients ever in a room, is there?
No, so every room had their own patient in them for the most part. So you would have to, you know, gown up to go into that room to do whatever you had to do. Typically, we would always keep our mask on and a surgical mask on top at all times. But every time you walked into a new room, you would have to throw on a gown, gloves, your face shield, and everything just to run into that room to do what you had to do for that, you know, whether it be 2 minutes or 20 minutes, and then move on to the next. So it was a constant, you know, gowning up, gowning down, and just, but always thinking in the back of your head that that's what you have to do before you step into any of these rooms, just to protect yourself as a nurse.
Wow. And then not only taking care of the patient and taking care of yourself, you still have the the onerous task of, you know, documentation for everything that you do for these patients. So how do you fit all of that in, or is that what the extra hours at the end of a shift end up looking like, is catching up on documentation?
Right. So that was definitely one of the hardest parts about this too, because in the ICU, we have to document everything every hour, vital signs every hour, their inputs and outputs every single hour. So when things are happening so fast and so many things are happening within 1 hour, it's almost impossible to run to a computer, to sit down, write down the changes, and then go back to what you were doing. So either you have to keep a list of what was going on and get back to it, or luckily, when the pandemic was getting really bad and we were getting 4 patients at a time, our hospital was, we were lucky enough that they were able to ease up on the documentation a little bit. So we were able to document every 4 hours rather than every hour on the dot. So that definitely gave us a little more time to, be with our patients more than having to sit behind a computer and document really what was going on every minute of the day.
Wow. I mean, it just seems so much. It seems overwhelming. I mean, you must have felt overwhelmed, and there's got to be other nurses that were truly new to critical care that had to be incredibly overwhelmed. And how did you see colleagues and yourself handling all that stress and pressure?
Absolutely. So, like you said, there were a lot of new critical care nurses that were actually starting during that time period, and they did these fellowships or residency programs. Something that I went through, it's a training program, and they were starting in like the midst of the pandemic. So some of them were coming straight off of orientation. So they were getting the same assignments as we were, because there was no way to really give them an easier assignment when all the patients were equally as sick. So I remember one time I was giving a report to a nurse who I was giving her report on, quite a few patients, and she just seemed like she was very overwhelmed. Has never experienced anything like this to the capacity of how sick these patients were. So I sat down with her for at least an extra hour. I stayed there and I kind of walked her through each room. I showed her the drips and how to titrate the medications, and what medications can go with what other ones, through what lines, and what they can't go through, and things like that. And always to ask questions, because you always have help and there's always people there. So sometimes as a new nurse, it's easy to just kind of try to go about things and cover things up and act like everything's okay, but you definitely need some help, especially as a new nurse going into such an overwhelming environment and situation. So that was definitely tough. And then, the other nurses that were more experienced or seasoned nurses, everyone had the same, I think, stress level. So we did several things to kind of, help each other at that time too. We created a Facebook group with all of Northwell's employees, which is the hospital system I worked for COVID, and everybody would be able to, express their feelings and say what was going on, and everybody would give each other feedback. My unit also specifically, we made a garden outside of our unit called a therapeutic garden. So we were able to go out there and we planted all different types of vegetables and lavender and things like that. So that was a nice little break we got to take to be able to go outside, get some fresh air, and do things like that to kind of, just relieve some stress. And we also dedicated that garden to the several patients that we lost at the time during COVID. So it helped us kind of remember what happened too, but also let us kind of let out some stress by being outside and, smelling the roses and being around the lavender and all of that. So that was great to have.
Wow, that is just so holistic and so self-care. It was wonderful that the hospital, was supportive of that. That is excellent. And it was a nurse's idea, no doubt, to do that, correct?
Yes. Yeah. One of the nurses who's very into all the holistic care, and, she's very big into the environment and all that kind of stuff. So she kind of implemented that into our workplace as well. And we used that and utilized that. And I think that helped a lot of us.
Well, so can you describe for people that will ultimately be looking and watching What is a Nurse, as a nurse, there are so many people that still think this pandemic is just a bad case of the flu. Can you paint a picture for them of what a really sick COVID patient looks like that you took care of?
Absolutely. So sometimes they'll come in and, they'll just be admitted for trouble working breathing. It's getting harder for them to breathe. So we wind up having to what's called intubate them on the spot, which is putting a breathing tube down their throat to help and have a machine kind of take over the work of their breathing. And when that happens, the patient needs to be sedated on several medications because being awake with a breathing tube in could be very stressful and anxiety provoking for the patient. And the ventilator's unable to do its job if the patient's too alert and awake. So we have to place them in a medically induced coma, which includes putting them either on a fentanyl drip, propofol, Versed, ketamine, things like that, to kind of really just make sure that they are sedated enough for the machine to do the work of breathing for them. Along with that, they're unable to eat. So we have to place something called a nasogastric tube for them to have supplemental feeds go through so they can get their nutrition as they're pretty much unconscious. Along with that, they are incontinent, meaning they're unable to hold in their bowel movements or their urine. So we have to place Foley catheters and typically rectal tubes to help with that. Most of the time they have very invasive lines, including something called the central line to access several medications into the bloodstream at the same time. Some of them have arterial lines, which measures their blood pressure continuously. A lot of the patients go into kidney failure that I notice a lot of these COVID patients. So we have to start them on either dialysis or something called continuous renal replacement therapy, or CRRT. So they have a large bore Shiley catheter placed in their groin or their neck, in which this machine is running 24 hours a day to help their kidneys kind of, get rid of all the excess fluid and everything building up in their system that their kidneys can't get rid of on their own. So when you look in the room, you see a patient with a breathing tube, a tube down their nose. You see tubes, in their urethra and their rectum. You see lines in their arms and their necks. And a lot of them have incisions. They have wounds. They have surgical incisions. They have wound vacs. A lot of them, have to go in for a few operations and come back with drains and tubes and lines. And it could really be frightening for a lot of people not in the medical field to take a look at that. So we always kind of have to warn the family members when they do want to set up a Zoom call or a FaceTime that this is something that is not, this isn't what your family member looked like before they came to the hospital. And unfortunately, these are the things that need to be done in order to keep them pretty much going every day until we can either slowly remove these things as they start to get better, or unfortunately have to add more things on if they're starting to get worse. So.
Well, that's gotta be really traumatic when you take an iPad and show family members their mom, their dad, their spouse, their son, their daughter.
Absolutely. In completely different condition that they saw them in before they walked into that hospital.
Well, share with us a little bit about one of the worst days that you had working in a COVID unit. What was that like for you, both clinically and emotionally, taking care of a patient or patients?
Mm-hmm. So I had a patient who was pretty much the exact picture that I just painted for you, with all the tubes, lines, everything going on. So he was very sick. He had COVID. He had pretty chronic hospital stay at that point. It's been about a month and a half, almost going on 2 months. However, he was starting to get better. So I had him for 3 consecutive days. And as those days went on, he was able to get extubated. The tube was able to come out. we were able to get him off of the sedation medication and the blood pressure medications, so he can kind of maintain his own vital signs by himself. So I saw so much good progress in those 3 days. And as the family members called every day, they're like, how is he doing? How is he doing? And I'm like, actually really good. This is happening or that's happening. And they're like, you're great. You're, one of the nurses who are telling us all the good things that are happening rather than all the bad things that are being added on every single day. So I was happy to be able to give them some of that comfort and that ease. However, on that 3rd day, probably mid shift or so, the patient wound up going into his breathing was starting to get very labored. He was kind of getting what's called hypoxic, so he wasn't getting enough oxygen into his bloodstream, so his mental status started changing. So we knew something was wrong, and we knew that he needed that breathing tube back. So unfortunately, we had to put the breathing tube back in, and we kind of had to take a step backwards and do everything that he basically started with, and to tell the wife that when she called that day that things had just, turned like inside out and backwards just in that short time period was kind of devastating, because she was under the impression that he was getting better every single day and going to be leaving that hospital. And within a few days, I came back and he was no longer there. And I think that was very heart-wrenching and very upsetting for not only myself, but my coworkers, for putting backbreaking work into that patient with getting him better. And along with the family members who were really just hopeful and thinking that he was going to be coming out of this when, he was doing so good. And the hardest part was that the wife, he was 86 years old and he was married for 62 years. His wife would call every day and they would set up a Zoom, and some days he would be conscious, some days he wouldn't be so much there. But I would set up the Zoom and let her speak with him. And she, it was just the cutest thing. It was always, I love you so much. I can't wait to see you. And she was just telling stories about her and her dog or things that happened that day and just talking to him, even though he wasn't all there. And just knowing that, they had that love for so long, 62 years, and they were together, and, and just, it's very upsetting that the fact that after that long of a time period, she couldn't even be there to pretty much hold his hand, during, those last moments or when that happened. So when I found out that happened, typically one thing I always do when a patient passes on me or, passes the next day or so, I'll always say a prayer. I do some research into the patient to find out, sometimes we have to look at their past medical history to see, if their family members had any history of any medical issues that, if they were deceased from. And I did find out that this patient's father had died from cancer and that his brother had died from a pulmonary embolism. So when he passed, I said a prayer and I basically felt a little more at ease, because I was able to kind of say, now you're with your father, you're with your brother, now you're in a safe place, you have people there and people who love you, and you're going to be with them, and everybody's there for you, and basically everybody loves you so much. So it was hard, it's heartbreaking to basically see how that progression happens in such a good way and then just can, go on a downward slope really quickly. And also the emotions that the family members have and that the wife had, imagine 62 years of marriage and just love and companionship and being unable to be there when this is all happening during the worst time probably in her life.
Well, but I'm sure you made such a difference for her, and she'll be forever grateful for your being there and helping and offering hope when, somebody else may not have offered that. And even though it didn't work out quite the way you all anticipated, you were still there, and your kindness of heart to pray for those patients is just very touching.
Thank you. Absolutely. Yes. I think she was very happy that, whether it was just a half hour of my 12-hour shift, she was able to just see him and talk to him and tell him all of these things that happened during the day. And she went food shopping and she saw, you know, she was basically telling her whole story to him, even though he wasn't really there. But I think that made her feel so good that she was able to see him and kind of talk to him as if, you know, he was there with her. And, you know, I think that's one of the best, I mean, best parts that could happen for these family members is being able to see them, you know, when a lot of the times, like, we're not even allowed to have visitors at all. So I think she was very much appreciative of that, despite the circumstances. So I was happy to be able to be there for her and her family that joined the Zoom call as well.
Oh, that's great. What, I guess, what is report like in the mornings when you get to your shift? I mean, how are assignments made in this time period of COVID?
So so basically, typically they would make an assignment based on the patient acuity. If the patient's really sick, they would make it a one-to-one nurse assignment. But like I said, being that these patients were pretty much all as equally sick, there was no way to make a really good assignment or an assignment that was going to be, you know, easy for the nurse, or not necessarily easy, but, you know, have a semi-smooth day where it's not going to be too chaotic. We kind of just, the charge nurse had to pretty much pair the nurse with 4 patients despite the circumstances. And we had to go into a report, and we did bedside report in every single room. And, you know, we were told the story and what happened overnight. And basically they gave us a head to toe assessment on the patient. And we just had to kind of go running from there and just take that information and go forward and, you know, get through the shift and do what we had to do, give the medications and titrate these drips and make sure their vital signs stayed stable, and just kind of get through that 12 to 14 hour shift.
So let me ask you this, when I hear of nurses having to take care of 3 and 4 patients, is that because there just weren't enough nurses to help during this time period?
Well, I think we had a lot of nurses because we actually recruited several travel nurses from all over the country, basically, to come and help us. However, I think the influx of COVID patients at the time was so high. Actually, the hospital I worked at was the second highest hospital COVID admissions in New York at that time. So we had several patients coming from Queens and all over Long Island to us, and almost too much to keep up with the demand of the staff. So we had opened up to 6 ICUs at least to be able to accommodate these patients. And at one point we opened up a specific ICU called Surge B. It's a 65 bedded COVID positive unit where you had 65 COVID patients basically in one big circle. And you would kind of go, and they were separated by curtains, and you would go from room to room to room, and you were assigned at least 4 of them. And luckily we were able to have some nurses that were called functional nurses who didn't have patient assignments, but they were able to help nurses with basic tasks, or, you know, the hygiene for the patients, or being able to run and get a medication when we weren't able to leave the bedside and things like that. So we were able to have a few extra hands. So we did make things work, along with the staff who worked in the operating room at the time, who didn't have really a role, being that nobody was getting surgery. So the nurses who worked in the OR actually came up with their own team, which was called the prone team. So basically that means a lot of the times we had to flip these patients onto their stomach to improve their oxygenation status with their lungs. That decreased the mortality rate a lot, actually, and that helped them. However, that process can be very scary to do when they do have all these lines in and they have the breathing tube in that can possibly be dislodged, you know, if you're moving them, turning them, things like that. So the prone team came together and they came up with a systemic approach, and in a way that we can smoothly prone these patients in a 4-step process and be able to get them on their stomachs safely and effectively, and that really helped us out a lot. So we were able, the hospital, really everybody worked together to kind of make things work and help the nurses. And we had doctors coming from all different specialties being pulled into the ICU to kind of help out, give extra hands. And really everybody was just all hands on deck at that point. And, you know, we just did what we had to do to get through it. And we really got through it. And in New York right now, we're doing amazing. My hospital probably has less than 5 COVID patients there now.
Wow, it's so, I mean, it's just heartwarming to hear just the creativity and the innovation of nurses with different backgrounds coming together and figuring out different ways to really support one another, the functional nurse, the prone team of nurses, you know, and those of you that were, you know, doing all of the direct bedside. I mean, it was just, it's truly like a beautiful team approach to total patient care that we sometimes don't always see anymore. And I mean, do you think it's going to change how nursing moves forward?
I think so. I think this experience really just opened everybody's eyes up to like a whole different world and the way that we work together and the way that things are done. I think we've grown so much, we learned so much, and I think we could take this experience and implement it into the future and how things are done in nursing in a different way. And maybe the new nurses coming in, teaching them some of the things and strategies that we did, maybe to prepare them for a situation like this. God forbid anything happens in the future, you know, that we'll be ready to go and everybody will be prepared. And I think we all did a really good job with that while we could.
So what do you see as some of perhaps the best practices to come out of this that really either need to be relooked at and kind of relaunched, if you will, in the world of nursing and direct patient care?
In a medical aspect, or?
Yes, from a nursing aspect.
Okay. I think just being able to be there, I think we were never really taught a course in, you know, death and dying that much. And I think that was one of the hardest parts for a lot of the nurses because we were seeing that so often. And, you know, that wasn't something we were used to happening several times a day. So I think that going forward, it would be, you know, beneficial to have kind of, you know, a little bit better of like an understanding of how to kind of be in that situation, you know, so often and kind of help people out during that time, whether it's the family or the patient. And also just kind of implementing things into nursing practice that, you know, weren't really done before, trying to help out nurses and along with the other interdisciplinary team together, the respiratory therapist, everybody kind of coming together to help each other. And I think just making nursing, you know, better overall as we go forward. And I think we're really aiming in the right direction right now.
That's great. What do you say to people that are doubters that this pandemic is real? I don't want to wear a mask and washing your hands all the time. I mean, phooey.
I would say, you know, that gets me very upset because they don't know what goes on behind the scenes. This has changed not only myself, but several nurses who have worked in the medical field or throughout this pandemic. You know, I feel like a lot of us are not kind of the same as who we were. They say, you know, we're going to have PTSD from this. And I feel like a lot of nurses are kind of experiencing that because this is something we will never forget. And people who don't work in the medical field don't see that and they don't understand that and they can just kind of brush it off like, oh, the numbers are coming down or it's fake news. But you're not the one there seeing these people suffer, taking their last breaths, being on ventilators in medically induced comas, you know, helpless basically. You know, what if that was your family member? And they don't look at it like that. They just kind of think this is just fake and that this can't happen to them. But this could happen to anybody. I've been seeing 20-year-olds with it, 20 years old up to 100 years old, you know? So people, you know, just have to be more cognizant of it and stop trying to say that this is not a real thing. And I think that we've definitely done a good job with getting, you know, better at what we're doing to kind of, stop the virus and the spread. However, people still need to be aware of what's going on and, be in the moment and not try to shoo this away like nothing's happening.
So how has it changed you, Jenna?
So I think now in Georgia, so I'm, currently in Atlanta, Georgia, doing my second COVID crisis response job. It's impacting me a little more because I do now feel the aftermath of what happened in New York finally kind of kicked in. And now I'm here in Georgia and I know kind of what I've been through. So I think that my interaction with these patients, when I do see, the death or the dying of these patients, kind of hits me a little more than I realized that it didn't prior, because now I know, what I've been through, and now this is still going on and I'm continuously seeing this, and it's just so devastating. And I mean, the other day, just out of nowhere, I just started breaking out in tears, and I really didn't have a rationale behind that. But I think that this was just, along with actually, I'm signing another contract to work down in Miami, in another hospital with COVID patients and things like that. So I think maybe that had triggered a little bit of that anxiety, where I just kind of broke down and realized, like, wow, I'm going to be going into this again. And, this is so real that this is not ending. No matter where I go, this is still going on, and I'm still going back into this fire. And I think it changed me in definitely a good way, because it gave me a lot of confidence to kind of go back into this several times. But also, emotionally, it's tough. You're not really the same nurse as you were when you first started out. And, I've only been a nurse for 3 years, but, this really does burn you out very quick. The stress and all the emotions, not only on yourself, but the patient and the family and everybody around you. So, it places a heavy burden on us for sure.
What do you think we can do to help support nurses like yourself and others that have so selflessly, dedicated and committed themselves to caring for others? How can we as other nurses, retired nurses, or the community at large really support and help you all?
I think you guys just need to be there to support us, emotionally and mentally. Doesn't need to be anything, tangible or gifts or anything like that, but just, recognition, that we are doing the best we can, and we are trying really hard, and we're the ones there behind the scenes now, saving these patients' lives when we never thought we'd be put in these situations. Just kind of having that support behind us really will help us kind of get through, this tough situation, and kind of be able to go forward after the fact when things are all done. But I think, for the most part, everybody has been so great and just so supportive of, what I've been doing and what every nurse has been doing behind the scenes and in the ICU and beyond and above that.
So if you were talking to a group of high school people or adults considering a second career, with all that you've been through and how you feel, what would you say to somebody that's considering nursing, what they should think about before they make that commitment to choose nursing?
So I would definitely, that's a tough question, because that's something I really didn't even think about that much before I went into nursing. Nobody really told me that this is something that I was going to possibly be faced with, and nobody ever thought that this is something we were going to be having to deal with. But what I would tell nurses is just to kind of be prepared for anything that might be thrown at you, whether you're, a novice nurse or an experienced seasonal nurse. Not everybody is prepared for something like this, and you kind of have to have that strong kind of backbone to try to really power through this as much as you can and get through it and be there for the patient, the family, and use your clinical and critical thinking as much as possible, and try to have to separate your emotions with your job at some point, where you kind of can't let them, interact and kind of, make things harder for you. So, I mean, it's definitely a rewarding profession. At the end of the day, I'm so happy to see all the, patients' lives that I've saved or helped, and touched. And I think that would, that's still a great part of nursing and such a great aspect of it. And I think that more people should be going into nursing for that reason. But there's, definitely ups and downs to it, just like every job.
So, so let me ask you this. One of the things that just intrigues me is that I think that most nurses, when they choose nursing, they think they're going in to help people that are sick. And with what this pandemic has done, and maybe it's also part of being a critical care nurse, but for a nurse to be able to recognize and know that he or she saves patients, saves people, is, I think, a different concept than what is, openly always talked about. And I think that's something that really needs to be shared and discussed more, because I think more people think of physicians as being the individuals that save patients, yet, you know, in reality, it's it's nurses who are there by the bedside 24/7. They turn over that care and that watch, if you will, to the next nurse, so that patients are really never truly alone, that there's always a nurse there to be with them
Right.
all hours of the day and night, 7 days a week, and holidays included.
Yeah, just like you said, I mean, the physicians, they do their magic, and then it kind of, it gets passed on to the nurses to be the ones to monitor these patients until the minute they leave the hospital. Like you said, we are with them every minute of every day for, it's around the clock job for 12 hours a day, and then on to the next nurse. And we're at that bedside whenever they need us, whenever we hear an alarm, whenever they use that call bell, we're the ones that are there. We're the ones that kind of attend to those needs. We see the changes in the patient, whether it's just something physical or if it's something on the vital signs. We recognize that. We're the ones who say, okay, it's time to call the doctor, or I have to pull in the respiratory therapist now, or we need some more help in here, because you can't always just handle or tackle a situation by yourself as a nurse. And the nurses are the ones that recognize those changes, I would say 95% of the time. And obviously you have everybody else there, the doctors and the PAs and the NPs there to help back you up and to help you and to get through everything. But, we are always there watching the patient at all times. So.
And Jenna, one last question for you is that I know that you're working as a traveler, which is technically it's a supplemental staff nurse type of role and position. How have you been received by the medical staff and the nursing colleagues that are full-time staff at the hospital?
It's actually been great, way better than honestly that I anticipated, because it's very a little intimidating coming into a new environment, not knowing anybody or not knowing the hospital or the system or the policies and how things work. But I'm actually one of the many travelers that are in this hospital that I'm at right now. So a lot of the staff nurses are very understanding of that, and they have all been so nice and so helpful the entire time. And I think they're just very grateful that we are there as well to help them out, because I understand what it was like when we were drowning up in New York without any extra hands. So I think that they are trying to do, everything they can to help us out as well. And I never had any issues as a travel nurse being in Georgia with, nurses not wanting to help or to be there or to, give you advice or to refer you to someone, or to, lead you in the right direction. So far, I've had such a good experience, and I think that's what's making me want to go on to my next assignment down in Florida. And I'm like very much looking forward to it, to see, what that hospital has to offer. And just, I think that also being in a new hospital, I am learning so much that I thought I would never be able to in my life. I'm seeing so many different things, a lot of different equipment, a lot of different ways that this hospital does things rather than how we did it. And that definitely expands your knowledge as a nurse, and, it makes you more appreciative of things as well. So it's been great.
No, that's wonderful. And I truly, I thank you for all your care and concern. And I want you to be my nurse if I, if I ever end up with COVID or in an ICU for whatever reason. I'm going to track you down.
Oh, thank you.
Are there questions that I can answer for you?
Hmm. Trying to think. I don't I don't know. What do you think that, as a retired nurse, looking back on your ICU experience, how do you think that now nursing is nowadays compared to what it was like when you were in the ICU?
Well, from what you just shared with me about the functional nurses and those that are helping do prone, it's a lot like when I was a nurse back in the critical care unit. We had other helping hands that, helped with, bathing and assisting patients, so that our role as a nurse was really to really care for, the high acuity of whatever their illness or accident required. And I think nurses today have a much more difficult, demanding job because the acuity of patients today is it's so much more acute by the time they reach hospitals, whether it's in a med surg setting or a critical care setting, that we didn't always have to deal with that same type of acuity and the complexity of illnesses that you all see and care for today. And I just think that it's so much more challenging between all of that and the fact that you're also, expected to be data collectors. When you think of the documentation that you do and through whatever the EMR system is that the facility uses, it's really a system that allows hospitals and hospital systems to go back and do a detailed analysis of the types of patients and look at their overall outcomes. And, everything now is so evidence-based. It
Right.
always has been, but it's even more so because the data accessibility is more readily available at the fingertips. And I think all of that has changed nursing and made it much more complex and demanding today.
Yeah, absolutely. Yeah, and things have changed so much. I feel like, my mom was a nurse, 20 years ago. She told me that nurses didn't even use gloves sometimes because that was, considered, you know, um, rude, or, they would be like, why are you putting gloves on to touch me, kind of thing. So she said it's just so different nowadays too, especially with the equipment that we're using and the technology that's happened and advanced. She was like, you could be a doctor, like compared to what she knew back then, when she was
Very
25.
true.
It's crazy. The times have changed.
It has. And, while we have this, we have COVID today, but we could have easily had an Ebola, kind of crisis as well. And that was averted. So, with the way the world is changing, this is probably just one of, many, unfortunately, pandemics that you as a nurse are gonna have to face throughout your nursing career, and a lot of other, disasters that we've never had to deal with. I mean, the aftermath of fires and burn patients and hurricanes and, all that brings with, cholera. And you look at some of the diseases that the folks in Haiti and the Dominican have had to deal with as a result of stagnant water,
Right.
and poor sanitation. I mean, all of those things kind of circle back to, the United Nations Sustainable Development Goals and what, as nurses, we're expected to have an impact on. So it's more than just critical thinking skills, but it's being able to go back and look at all of those specific items that are part of that we have to look at how we as nurses can impact and help and assist through.
Absolutely. And just kind of being able to do that research and help in certain ways and change practice can definitely make a difference going forward.
Yep, always pivoting.
Yes, of course.
Always plans A, B, and C. That's the beauty of nursing, I say, is that one thing they teach us is our assessment skills. They carry us through life because every situation is, an assessment situation where you go through and you figure out what it is that you see, you analyze it quickly, and then come up with a plan. And
Mhm.
everything we do in life is really establishing a plan of care for ourselves, for our loved ones, our families, our neighbors, our community.
Yeah, that's so true. And everybody basically could work with us, you know, outside and
Yeah.
implement it that way too.
Yeah, absolutely. Well, I thank you, Jenna. This was really valuable, and I appreciate your carving out time. And I'm going to let you go and enjoy the rest of your busy single day off.
Of course. Thank you so much for having me on. I'm so happy I was able to kind of share my story and, you know, answer your questions.